Hey everyone, welcome back to all my listeners. This is season 16, episode 5. Today is Wednesday, October 1st, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, good morning and welcome to a brand new month. Now, as the month starts, there's so much going on in the news already. The government here in the United States has already officially shut down as of a few hours ago, and it feels like we've definitely stepped off a cliff. Now, healthcare changes are officially here. I've been alluding to them for quite a few months now, but healthcare changes are officially here. The telehealth flexibilities that we've all grown accustomed to here in the US are gone. This means that millions of Americans that have grown accustomed to telehealth services, that means services that we can take at home in the comfortability of our homes, either via a audio only service or a two-way audio visual functionality. All of that is now over. Those flexibilities that we have been offered since the COVID-19 pandemic are now expired. So there's a lot to unpack there for all of our hospital systems across the nation, our healthcare practices, our smaller physician practices, our day-to-day folks in the offices, what do they have to do, etc. So much is officially changed today, October 1st, 2025. Now, my good friend Keisha Wilson and I are having an all-day workshop in a few weeks, and we do unpack all of these things about telehealth in our telehealth playbook for 2025 through 2026. And we do talk about all of these things. We had predicted a lot of these things, and we will be unpacking what to do for now that October 1st is technically here and technically the government has shut down and those flexibilities were not passed to renew. So we'll unpack all of that in the workshop. And again, I will provide my link to that in my show notes. But I really wanted to talk about that big news. October also is a big month for pink, right? It is Breast Care Awareness Month, the entire month. So I will do my best during these episodes here for the entire month of October, as I've done in every year of the podcast. I highlight Breast Cancer Awareness Month with my Trusty tips or newsworthy spots on awareness, big days that are in the spotlight for breast care awareness for the month of October. So I will include all of that in the month as the weeks go on as well. So a lot to talk about. There's also, in today's Newsworthy feature, I'm going to unpack the fact that our ICD10 codes for diagnosis coding are officially in effect today, October 1st, for 2026. So as of today, you should be updating your EMR systems. You should be double checking that all of the new ICD-10 codes are within the EMR systems, etc. I've seen many a time when that is simply missing when the new codes take effect. And be aware, they do take effect today, October 1st, for 2026. So don't be confused by that practices. Those codes for diagnosis coding, ICD-10, officially take effect today, October 1st. And then, of course, in my trusty tip, I'm going to quickly focus on telehealth today because a MAC in my region in the state of Illinois, National Government Services, they did issue a reminder to all of us a few weeks ago on what telehealth would look like today. And they must have had their crystal ball because this reminder sheet that they put out is still effective today, in my opinion. So I'll unpack that as well. And then, of course, I'm going to go ahead and round out and close out today's episode with another remarkable quote on resilience from Nelson Mandela. All right, you guys, let's get into it. So in today's Newsworthy, the ICD10CM is effective today, October 1st, 2025, for our calendar year 2026. Now, our code books that we should have all received in the mail, or if we're using the e-versions, absolutely fantastic tools. Our ebook also includes 487 new codes with the most changes in chapters 12, which is for our diseases of the musculoskeletal system and connective tissues, as well as chapter 19, which is for injury, poisoning, and certain other consequences of external causes. Now, key updates involve greater specificity for non-pressure chronic ulcers, new codes for adverse food reactions, and changes to the coding of HIV and type 2 diabetes in remission. Now, these updates are released by the Centers for Medicare and Medicaid Services, that's our CMS. And of course, these codes enhance coding specificity to improve patient data, treatment development, and statistical accuracy for our public health reporting purposes. Now, key updates in the 2026 ICD10CM code set include increased specificity. Now, the most notable change is the increased specificity for non-pressure chronic ulcers, with over 100 new codes detailing site and severity. Now, adverse food reactions. New codes have been added for adverse reactions to milk and dairy products. Now, HIV coding. Significant changes and clarifications have been made to the selection and the sequencing of our HIV codes. Type 2 diabetes in remission. New guidelines and codes reflect the status of type 2 diabetes in remission. And also, heads up, HIV coding, there's also comprehensive overhauls in the guidelines as well. And I'm going to touch on those in a moment. Now, for injuries and poisoning in Chapter 19, for injury, poisoning, and certain other consequences of external causes, there have been substantial updates, including the addition of the body site flank for injuries. Now, also for functional disorders of polymorphonuclear neutrophils now have a parent code. And then for multiple sclerosis, for RMS, there has been issued a new parent code within the system. So there's much more specificity that is needed. Now, I wanted to highlight the overhaul of guideline changes for HIV. Now, the biggest revision to the ICD10CM official guidelines involves the way coders select and sequence human immunodeficiency virus. Those are our HIV codes. Now, CMS has made numerous changes to the guidelines in sections IC1A2, including coding changes for various scenarios involving patients before, during, and after an HIV diagnosis. Now, keep in mind, all of this chapter guidelines are available to the public, and this year it is 121 PDF pages, and you can read all of the changes and additions that have been made, and they are notable in bolded text throughout the 121-page PDF file. So keep that in mind, and this is what I am reading from and try to encapsulate all of it nicely for my audience. Now, the first change involves the insertion of a new guideline in IC1A2A, which tells you to assign B20 for human immunodeficiency virus, HIV disease, when physician documentation indicates the patient has acquired immunodeficiency syndrome, or AIDS, HIV, quote, or if the patient is treated for any HIV-related illness or is described as having any conditions resulting from the patient's HIV-positive status, end quote. Now, the guideline at IC1A2C also adds clarification that you can assign B20 as a secondary diagnosis for patients with HIV who have been admitted, quote, for an unrelated condition such as a traumatic injury, end quote. Now, the same is now going to be true for, quote, other documented conditions, end quote, per the guideline revision. Now, the update also clarifies use of Z21, which is for asymptomatic human immunodeficiency virus HIV infection status. Now, under the new guideline at section IC1A2E, you're told to apply the code, quote, when HIV positive, HIV test positive, or similar terminology is documented and there is no documentation of symptoms or HIV-related illness, end quote. Now, for patients with inconclusive serology of HIV, the guideline at IC10CM still tells us to assign R75, inconclusive laboratory evidence of human immunodeficiency virus HIV. However, the language, quote, but no definitive diagnosis or manifestations of the illness has been deleted. Similarly, for patients previously diagnosed with HIV, continue to assign B20, but now the diagnosis will have to be documented and not previously known per the guideline revision. Now, another change tells us to assign O98.7 for human immunodeficiency virus HIV disease complicating pregnancy, childbirth, and the puparium only, quote, when a patient presents during pregnancy, childbirth, or the puparium with documented symptomatic HIV disease or an HIV-related illness, end quote. Also assign Z21 for pregnant patients, patients giving birth, and for patients during the puparium who are either HIV positive or who have documented asymptomatic HIV. Now, at IC1A2I, the language changes from, quote, if a patient is being seen to determine his or her HIV status, to, quote, if a patient without signs or symptoms is tested for HIV. Additionally, for patients with signs and symptoms presenting for testing, you are now told not to report Z11.4, encounter for screening for human immunodeficiency virus, HIV. Now, the guideline at IC1A2J provides revised instructions for reporting HIV-positive patients who are being treated with an antiretroviral medication. In fiscal year 2026, assign Z21, quote, in the absence of any additional documentation of HIV disease, HIV-related illness, or AIDS, end quote. So that's huge, comprehensive, and many, many pages worth of review for this synopsis that I gave to everybody. So I hope that makes sense. And if you are a coder in this type of infectious disease population, I think these new comprehensive overhaul to the guidelines was necessary. I really liked it. All right, I want to move on quickly to the highlights for the new guideline for diabetes. Now, reporting type 2 diabetes mellitus in remission specifically. Now, the ICD10CM official guideline adds a new subsection regarding type 2 diabetes mellitus in remission conditions to coincide with the new codes identifying this status. Now, subsection IC4A1B instructs you to assign E11.A type 2 diabetes mellitus without complications in remission when the provider's documentation indicates the diabetes mellitus is in remission. Quote, if the documentation is unclear as to whether the type 2 diabetes mellitus has achieved remission, the provider should be queried, the guideline states. Now, an example of when the documentation is unclear would be if the provider wrote the term, quote, resolved, which is not the same as the condition being in remission. And now it's time for my best practice tips in Trusty Tip. Now, NGS, the National Government Services MAC out here in the Illinois region, had put out a reminder on telehealth extensions expiring on September 30th, a few weeks back. And sadly, in my opinion, it is still applicable today on October 1st, 2025. Now, the reminder states, quote, reminder, Medicare telehealth extensions set to expire September 30th, 2025. And yes, they did. That's a fact. Now, in March 2025, Congress granted extensions to the PHE changes, the public health emergency changes for telehealth coverage with the passage of a federal government spending bill. This bill allowed these changes to continue through September 30th, 2025. National Government Services is sharing as a reminder to all providers that absent any additional action by Congress, those extensions will expire at the end of September 2025. This means that beginning October 1st, 2025, Medicare telehealth policy in most cases will revert to the policy as it was prior to the COVID-19 PHE, public health emergency, in March 2020. So let me just digress here from the reminder that they issued, the fact that they had a crystal ball and they knew this was going to happen. As I'm talking about this today on October 1st, it is a fact. Things are going to be reverted back to pre-COVID times for the telehealth landscape. Let me continue. Now, with the expiration of these extensions, NGS will process telehealth claims with dates of service October 1st, 2025, and after, based on established Medicare telehealth policy. And that policy includes the geographic location will be limited to non-MSA or rural areas for patients to receive telehealth. This means the Medicare patient must be in a rural originating site location. The only exception will be for behavioral health services. The patient home will no longer be considered an originating site except for behavioral services that have been allowed by law. Telehealth services may be provided by physicians and non-physician practitioners as identified by policy. Physician, nurse practitioner, physician assistant, nurse midwife, clinical nurse specialist, clinical psychologist, clinical social worker, registered dietitian or nutritional professional, or certified registered nurse anesthetist. That's hard to say. And then physical therapists and occupational therapists will no longer be authorized to provide services via telehealth. Behavioral health telehealth visits are allowed if the patient has been present for an in-person visit within 6 months prior to the telehealth visit. This does mean patients being seen via telehealth would have to have been seen in person since April 1st, 2025. Thank you, NGS, for doing that math for us. So behavioral health patients have to have been seen in person by the provider on April 1st, 2025 for it to be viable. Let me continue. Telehealth coverage for behavioral health may continue if the patient is seen at least every 12 months after the initiation of telehealth. Telehealth service definition is an audio-video service. Audio-only services will not be considered telehealth unless specifically allowed under Medicare policy. Currently, this only applies to behavioral health services. Hospital at home provisions will expire September 30th, 2025 as well. So it's October 1st. Those hospital at home provisions have expired. If you have patients in their home receiving inpatient care, they will have to be inpatients in your facility beginning October 1st, 2025. Now, keep in mind, CMS has extended through December 31st, 2025, the fact that practitioners may directly supervise through real-time audio-video interactive telecommunications, including presence and immediate availability. Distant site practitioners may use their currently enrolled practice location instead of their home address when providing telehealth services from their home. Suspended telehealth frequency limits on subsequent inpatient visits, subsequent nursing facility visits, and critical care consultations. So all of that is in effect through December 31st, 2025. And finally, I focus season 16 Spark on resilience. I want this 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their statements involving resilience. So, in this week's inspiring quote, in Spark is from Nelson Mandela. Do not judge me by my success. Judge me by how many times I fell down and got back up again. Absolutely true, right? This quote really makes you think. This quote reminds us to not judge ourselves when we stumble and fall. This quote reminds us that we do not have to be like the Joneses. The grass is not always greener. This quote encourages us to keep working hard despite everything. Because although you have endured many stumbles and lost your footing, you do inspire others by showing them your grit and your grace. I'm happy Nelson Mandela's spark burns brightly and continues to inspire so very many. All right, you guys, that wraps up today's episode. This was a big one for October 1st, right? So much is going on. I really wanted to provide you with a variety of the newness that October brings. So I really, really hope you guys got a lot out of this. I hope you are going to continue carving out time for yourselves, despite the fact that October is going to be the beginning of kind of a new era for us in healthcare, right? Kind of new times once again. I know we're very used to adapting to the changes, but this is one that's going to take a moment for us all to digest, especially for this telehealth landscape, right? So anyways, you guys, I hope you're all doing well out there. I hope you take time out, carve out happy moments for yourselves in the day, and especially during the weekends. All right, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.